All right, Mr. Smith, my name is Jate Gillum. I'm a Tuskegee University nursing student. Could you please tell me your name and date of birth? Thank you. All right, then I'm gonna do a second identifier like the wristband. Before I get started, I'm gonna check your MAR. This should be my third check. I'm gonna just check your orders, the medications you should be getting, and your dose. I'm gonna be giving you an IM medication and a subcutaneous medication today. So your MAR stuff looks good. I got everything down. So I want to perform hand hygiene and put on some clean gloves. I'm going to be starting with your, before I get started, I want to let you know your 10 rights to medication administration, right patient, right medication, route, time, and dose, and then right reason, right response, right documentation, education, and you have the right to refuse at any time. If you don't want this medication, just let me know. Yes, I'm going to start with your sub-Q injection. All the different sub-Q sites are, the lower abdomen, your upper outer portion of your arm, and the interior thigh, but I'm going to be doing your lower abdomen today. I saw on your MAR that you got your injection on the left side last time, and since we should be alternating with each injection, I'm going to do it on your right side. Is that correct? Okay, thank you. So now I'm going to palpate and inspect the site. Does that feel tender? Does it hurt any? Okay, I don't feel any masses, and I don't see any bruising, rash, redness, signs of infection. So now I've identified my site, clean with alcohol, circular motion, inner to outer, as best I can. Oh, this is dirty. Throw that in the garbage. And as I'm letting that dry, I can go ahead and pull up your medication if I already pulled. For instance, insulin would probably already be pulled. But just to show how I give my medication. Be careful because the insulin needle is really delicate, it bends easy. Pull my needed medication. Aspirate. Make sure I got all the bubbles out, air out. All right. That's dry now. I'm going to pinch the skin. All right, we're going to feel a little poke, Mr. Smith. Inject the medication slowly. Oh, this so full. I don't even go in. I'm not going to go in. Throw this in a sharps container, and then I can apply pressure to the injection site with some gauze. Make sure not to massage the medication. And you just want to gently apply pressure. And then I can tape the gauze down if needed, in case of bleeding. But I'm going to trash it for now. Okay, next we're going to be doing your IM or intramuscular injection. I'm going to pull your shirt back down and pull your blanket back up. And now I'm going to expose your upper arm. I'm going to go ahead and palpate and inspect this site as well. No tenderness. Okay, I see no bruising, signs of infection. I feel no masses or hardness. So now that I got the site identified again. Oh, and all the different types of IM injections are the deltoid, vastus lateralis, and then your dorsal gluteal and your ventral gluteal. But I'm doing the deltoid today. Clean it inner outer faction. And as I let that dry, again, if your medication isn't already pulled, I can go ahead and get it ready at this time. Careful. Pull the ordered amount of medication. Aspirate. Make sure you get all the air out. All right. You want to feel a poke? Slowly inject the medication. Again, apply pressure. Don't massage the site. Throw this needle in the sharps container. And then I could tape down the gauze or put on a bandage in case of bleeding. All right, I'm gonna pull your shirt back down. I'm gonna lower your bed back down. You need anything else? No? Okay, thank you. Okay, hi. Right now I'm gonna be doing my skills. I'm going to be starting a IV fluids. I'm gonna be starting an IV, a secondary fluid or medication. I'm going to be starting an IV, giving IV push medications, doing a saline lock, and then discontinue my IV in this video. So first I'm gonna start by preparing my IV fluids. Oh, and for video purposes, before I started, I did hand hygiene, put on clean gloves, introduce myself to the patient, make sure I use 2 identifiers to identify my patient, and check the MAR to make sure this is correct patient, correct medication, make sure that it is good compatibility between the solutions and the other medications going. Yes. So first, I'm gonna start by spiking my bag, sparking my primary bag. I'm gonna push the solution about halfway up to the line, squeeze, And then I'm going to prime and get all the air out of my tubing. Okay. Alright. And now I'm going to do my secondary line. Again, do the same thing, spike. And get it prime to get all the air out. So for piggyback, it would be a shorter tube, and with your primary one, you would
It's 100.
hang it lower. And then for your piggyback or your secondary medication, you would hook it up at the level of the pump or above the pump, so it can be going in majorly instead of the solution, for instance, normal saline. So it'll be hooked up to the pump. Okay, now I'm gonna start my IV if I haven't already again, or if I need to wash my hands, put on some clean gloves. So before I begin, I can go ahead and get my station set up, open up my kit, my IV kit. Prepare all my equipment. Okay, and before I begin, I can go ahead and do my saline lock, which is just priming the tubing that's going to be connected to my IV. Make sure to unclamp it, if that is unclamped, and get all the air out. All right, put that to the side for now. Okay, what did I just do my tourniquet? Okay, now I'm going to apply my tourniquet. It's going to be a little tight, but I'll try to go as quick as possible. And as I tie, I'm gonna use a quick release knot. Okay, now I'm gonna try to figure out which vein I want to use. Just looks like a good vein. I'll take my antiseptic solution, click it to release the medication. And clean up and down. I'm gonna go ahead and clean the whole arm, just in case I don't get the first stick. Back and forth, and in circles. Now let that dry. I'm gonna get my needle out. All right, Mr. Smith, I'm now going to insert the needle. You might feel a little poke. So as I insert, I'm going to go bevel up, and I'm going to pull the skin tight to make it easier for the needle to go in. Control the blood. You know how to do that? I think it's unclamped, so clamp it when I say I see blood return. All right, I'm going to inject, bevel up. Keep going until I get blood return. Okay, I'm getting blood return slowly. You can clamp it. Thank you. Now I'm going to hold pressure and thread my needle so blood won't go everywhere, and throw this into a sharp turner. It's clamped. It's leaking.
Just carry up and connect it.
Okay. Connect my tube in. And then I can place a piece of tape down to keep it from coming out. Release my tourniquet. And then I can flush the tube in. unclamp it, flush the tubing. And just to make sure it's in the right spot, I can also pull back a little bit to make sure I'm getting blood return, which I am. Okay. Now I'm going to where's my bandage? Apply my bandage. Make sure to secure the IV down. And then it's a little sticker that comes on most of these that I can save, so I can initial date and time it, so the next person can know when it needs to be changed. The next nurse on shift. Now I'm going to take this up in a J shape. Alright, and then I would clamp it off, but since I'm going to go ahead and hook him up to some medication, I can unclamp it, make sure both my clamp tubes are unclamped, and hook it up. Alright, so now this is a little later, and now my patient has an order for a IV push fluid. Again, I'll come in here performing hygiene, put on gloves, check the MAR, make sure it's the correct patient, correct order, dose, time, and route. So I would disconnect this from the pump, the tubing from the pump. And then I don't have any extra saline on me. But before I administer my medication, this is gonna be my medication today, I would flush with some normal saline to make sure it's still patent. Now I'm gonna hook up my medication. And then before I came in here, or when I came in here to check the MAR again, I would also make sure I had the right push rate. So go slow, infuse medication at the recommended rate. And then once I'm infusing done infusing all the medication, go in with some more saline to clean out the tubing. And then I can get back up to the pump solution or medication when I'm done. And discard everything. Okay, the last thing I'm gonna do, my patient is done with all his medication and all his fluid, so I'm gonna discontinue my IV. Depending on how long it's been on here, the tape has been on here, and the bandages have been on the patient, it can be really sticky and hard to remove. So I'm gonna use some alcohol to loosen up the tape so it can make it as comfortable as possible for the patient. So I'm gonna go slow and try to be gentle as to not, before I would have put the alcohol in there, I would have turned off my pump and unhooked my tubing. Now, I already loosened it up with alcohol, and now I'm taking the tape off. Be gentle, you don't wanna pull on the needle and hurt the patient. Okay, gently pull the needle out and put some gauze on it, because some patients will bleed. Put this in a sharps container, and then I can tape it off, because some patients will bleed for a while, and we don't want them to get blood everywhere. All right, and those are my skills. Thank you. All right, hi. So right now I'm going to be putting in, well, hi, Mr. Smith. My name is Jacquette Gillum. Right now I'm going to be putting in a foley cath for you. I'm going to be taking the urine sample, doing some routine catheter tube care, and then discontinuing it. So first I'm going to wash my hands. I can put on a clean pair of gloves. I'm not going to though. No, first I'm going to open up my foley kit to get started. Wash my hands, open up my foley kit. All right. Oh, I did mean to say, before I open my foley kit, because I want to be careful because it is a sterile kit, I would get the bed to the highest position, best working position for myself, and get you in a position that is comfortable for you and comfortable for me to work with. So I'm going to pull up your gown because I have the exposure, okay? And I need you to flex your knees as best you can so I have a good view of your private area. Okay, now I'm going to open my kit. I want to start with opening away from me. Then I'm gonna, oh, I hate these. Then I'm gonna open the sides. First, I have my sterile gloves. Put these on. Start with my dominant hand. Making sure not to touch the outer side of the gloves. Okay, once I have both gloves on, I can adjust them to make them as comfortable as possible. Okay, so the first thing in my Foley kit is a drape, which I can use to either put under my patient or on top of it, shine it down. I'm going to put it on top of them to make my sterile feel bigger because you already had the pad up under them. And I also have this, which I can drape over this private part if need be, but I'm not going to glue it because it tends to get in the way when cleaning with the iodine. So I can trash that. But next, I'm going to set up everything. This is my urine collection cup, which I am going to be using later because I'm going to get some urine from him. I could first start by opening my iodine swabs. Send them to the side for now. Open up my lube. I'm gonna put this lube on the catheter so it's easy to go into the patient. Trash as best I can. And then I can take the catheter out of the tubing. Do it carefully. You don't want to fling around because you don't want to give everywhere and get contaminated. Trash. Rub it around in the lube. Leave it there to sit. And then I'm going to attach my syringe to the catheter because this is what I'm going to be using to inflate the balloon to get the catheter to stay inside the patient. Now I'm going to clean with iodine solution. One Q-tip at a time. With women, you would go side, side, middle. With men, you just go around on different surfaces. Clean as much of the area as you can. Trash. And then the last swab. And trash that. All right, Mrs. Smith. Now I'm gonna get ready to. Okay, the whole time I don't think I did it, but the whole time that I'm touching him with this hand, I'm making sure not to touch anything else with that hand. I'm using my dominant hand to touch everything on my tray because this is not sterile, but this is for right now. All right, Mrs. Smith. Now I'm going to insert. Okay, I just want you to take a deep breath in. Feel a little pressure. In. Okay. And then I'm going to keep inserting until I get some urine return. Which I did. And then go about 2 more inches. Okay, once I have it in the correct place, I can inflate the balloon using the solution. Okay, there you go. Do it slowly. It ain't gonna go inside him. Okay. Trash this. And then I could tug on it just a little bit gently to make sure it's not gonna come out and it's in the right spot. And then this kit doesn't come with it, but it would come with the sticker to attach the catheter to the thigh. To do that, you will go ahead and attach the sticker to the catheter. Find a good placement for where you want to have it on his thigh, because when you attach it, you want to give some pull. So just in case you want to give it some, I guess, pull room, I would call it. You want to have it too tight or too taut, because then it could snug, be uncomfortable for him, or come out. So when you have the perfect area on the thigh, you want to clean it with alcohol, clean it with skin solution, let that dry, and then you can attach your sticker, date, and time it. Okay, next I'm going to collect a urine sample. So, I hate this undone. I have some alcohol pads with me. First, I'm going to make sure that, I forgot to say, hang the bag low. Once you're done connecting that to his thigh, hang the bag low on the unmovable part of the bed. You don't want to get snagged or tugged. And make sure it's always below his bladder. Now for my urine collection sample, I'm going to make sure all the urine is drained down into the bag before I start. And then I'm going to clamp off his tubing. I hope this don't come out. Clamp his tube, and I can use the rubber band, I can use the blue thing, whichever is easier for me. I don't even know how she did this. He's clamped. I would do this 15 to 20 minutes before I initially take the urine to let it some new urine get into this tubing, the first part of the tubing. And then I would come back 15 to 20 minutes later. Now I'm going to be pulling the urine from this port. I'm going to clean with alcohol. Let that dry, trash it. And then I'm going to be using this syringe. It has a detachable needle. And I can go ahead and open my urine cup. Be careful. Insert the needle. Pull out 30 milliliters of urine. Nothing's not going to come out. Okay. Where does that go? The needle top. It's okay. I would throw this needle.
On there.
Yeah. Throw this in the trash, and then I can push the urine out into the cup. Initial and date it so it can go to the lab. Now I'm gonna do some routine catheter care. At the hospital, we typically have peri wipes. So I would hold the structure, make sure that my hand is clean. I would try to be as clean as possible. Put on washed hands, put on clean gloves, and I'm gonna hold the catheter right here so I don't tug on it or make him uncomfortable. And I'm gonna start at the very tip of the penis as much as I can and go down it in a circular motion. And do that a couple times. If the peri wipe got too dirty or too messy and I feel like I need to get another one, I would, and keep doing this till I feel it is clean. All right, now I'm gonna discontinue. To discontinue a urinary catheter, we wanna grab the syringe. After doing hand hygiene, put on gloves, grab the syringe, apply it back to the catheter, pull all of the saline solution out so you can deflate the bubble. All right, Mr. Smith, now I'm gonna pull the catheter out, take a deep breath. All right, then clean up and get him back in a comfortable position and lower the bed. Hi, my name is Checkoff. I'm a Tuskegee University nursing student. Can I please have your name and date of birth? Thank you. And I'll also do a second identifier like a wristband or a MAR. Today I'm here to insert an NG tube, do some routine care, give you some medications by the NG tube, and discontinue it. So before I start, I would do hand hygiene and put on some clean gloves. And before I came in here, I probably got like a towel, some paper towels, or a cup of water or ice chips for the patient for them to swallow as I'm inserting the NG tube. Okay, so the very first thing I'm gonna do is measure it from the tip of the nose, behind the ear, down to the sternum or the xiphoid process. It's about 50, and then I can mark that off with some tape. Okay, and then before I insert it, I can lubricate the tube, the NG tube, get it lubricated as possible so you make it comfortable for the patient. Okay, as I insert, sir, I want you to try to swallow or take small sips of your water or ice chips if you can, okay? Shh. Thank you. All right, swallow. All right, and stop at where I marked my tape. I can remove my tape. I think again. Make sure not to pull on the patient and tape it to their nose so it doesn't come back out. And then I can also use some tape to mark where it is, just in case it slips out or it moves so the next person will know, or I'll know. And then I can clamp this to the patient's gown or bed, or even hook up to suction it if needed. And then to test and make sure that it's in the right spot first, I'm going to connect this to the tubing because I'm going to pull back and see if I can get some residual, some stomach contents, which I do. And then as I push back, I can listen to make sure it's in the right spot as well. I should hear some bubbles or some air. And then while he has his NG tube on, I will be checking his residual continuously throughout the shift and every day. And if it's over 100, I would hold feeding. Next, I'm going to do, and then for routine care of an NG tube, at any time a person has an NG tube, we will make sure to be checking the site, the nose, every single day. We can make sure, see if the tape is soiled, if it needs changing, if there's any leakage from the nose, or if the nose looks dry, we can apply some moisturizer. Next, I'm going to be administering medication through NG tube. I don't have the correct tools with me today, but I will get these. Whatever pills, liquid, laxatives, I will need pill cups, a pill crusher, some water, and the syringe. I will put each pill in its own cup, mix it with water, crush it, mix it with water, and then I would connect the syringe to the tubing. First, I would go in with some water, and then one at a time, I would put in the medication, go back in with some water, put in the next medication, go back in with some water, over and over again until I'm done. And then at the very end, go in with some more water and push all his medications in. And then lastly, I'm going to discontinue his NG tube. So I'll also go ahead and have some paper towels just in case any secretions come out or anything like that as I'm pulling. But all right, Mr. Smith, I'm going to get ready to pull. As I'm pulling, I want you to take a deep breath in. And then when he exhales, I'm going to, I can go ahead and take the tape off. The tape will already be off. And as he exhales, I'm going to pull the NG tube out in one swift, continuous motion. So breathe, breathe, breathe. All right. And discard all my supplies, clean up, and get the patient back comfortable. Thank you.